Welcome back guys. Now in this video let's discuss a very important topic but small but important topic. That is the relationship between hypoxia and pulmonary circulation. Okay, hypoxia and pulmonary circulation. Usually in the systemic circulation, if there is hypoxia, what happened to the blood vessels? See, imagine that this area of my hand is getting hypoxic. Okay, this area of my hand is getting hypoxic. Now what happened to the blood vessels which are perfusing this area? Now what happened to the systemic blood vessels which are bringing the blood to this area of hypoxia? Now these blood vessels, they will be dilated, especially the arteries, they will be dilated. Why they are getting dilated? Why? Because dilation of the blood vessels will increase the perfusion. Now dilation will increase the perfusion, so hypoxia will be gone. Okay, hypoxia will be treated simply. So in systemic circulation, if anywhere there is hypoxia, means the blood vessels will undergo vasodilation. So hypoxia in systemic circulation causes vasodilation. But what is that? Something different with the pulmonary circulation. Now let me ask you something, think logically. Now why blood is going to the lungs? Blood is going to the lungs for the purpose of oxygenation. Everywhere in the body, blood is going to the tissues for giving oxygen, for delivering oxygen. But in lungs, blood is going to uptake the oxygen. Okay, blood is going to the alveolus for the purpose of oxygenation. Everywhere in the systemic circulation, blood is going to tissues for delivering the oxygen. Okay, now let's see, in pulmonary circulation or in lungs, if there is hypoxia, means, see, in my lungs, or I should say something like this. See, here is a lung. Okay, here is a lung. Now in this lung, there is this one area where there is hypoxia. Okay, there is this area where there is hypoxia. Now hypoxia means what? In this area there is no oxygen or very less oxygen is there. Okay, let's take it as no oxygen is there in this area. Now tell me, is there any need for the blood to go to this area? Now I am asking you, see, here are the blood vessels. Imagine these are the blood vessels, pulmonary blood vessels which are going to this area. Now is there any need for the flow of blood to that particular area? First of all, why the blood is going? Blood is going to uptake the oxygen. First of all, their oxygen itself is not there. Now what is happening now? Now these blood vessels, now they will undergo vasoconstriction. The blood vessels will undergo vasoconstriction. So in pulmonary circulation, if there is hypoxia, means that will cause vasoconstriction. This is absolutely normal. Okay, this is absolutely normal and this is beneficial also. Why? Because in that particular area there is no oxygen. Now if the blood vessels are constricted, means at least the blood which was supposed to go to the area of hypoxia, now it will be diverted to the healthy region. Okay, healthy region where there is oxygen. So what I am saying is, I am repeating, the blood which was supposed to go to the area of hypoxia now is getting diverted to the healthy area. So there it will be oxygenated. So at the end of the day, important point which I want to put into your mind is, in pulmonary circulation, if there is hypoxia, means that will cause vasoconstriction. How this will happen, sir? Now look here, this is a blood vessel. Okay, here is a blood vessel. On the blood vessel, smooth muscle is there. Now if that smooth muscle is contracting, means there is vasoconstriction. If the smooth muscle relaxes, means there will be vasodilation. So normally these smooth muscles are absolutely relaxed. Okay, they are absolutely relaxed. How we can say? Sir, on these smooth muscles there are these channels. Please look at these channels. These channels are potassium channels. All the time potassium is going out. Okay, all the time potassium is leaking out of the cell. If positive charges are leaking out of the cell, now the cell is under negativity or cell is hyperpolarized. Okay, the cell is hyperpolarized because all the time positive ions are leaking out of the cell. Now what hypoxia will do? So whenever there is hypoxia, that hypoxia will close these channels. Hypoxia is going to close these channels. So these channels are called as oxygen sensitive potassium channels. They are sensitive to oxygen levels. Whenever there is hypoxia, these channels are blocked. And when these channels are blocked, what happens? Potassium starts to accumulate inside the cell. Now what is this potassium? Potassium is a positive ion. So positive ions are getting accumulated inside the cell. That will cause depolarization. So hypoxia will cause accumulation of potassium ions inside the cell. That will cause a depolarization. When the cell is depolarized, this is a smooth muscle cell. calcium will start to enter. Okay, when the cell is depolarized, now what happens? See, calcium influx happens. Okay, calcium is coming into the cell. Now what this calcium will do? Calcium will help in contraction of the smooth muscle. Okay, now this calcium will help in contraction of the smooth muscle. When the smooth muscle is contracted, okay, so calcium is coming into the cell. Now when the smooth muscle is contracted, that will cause vasoconstriction. So this is how the pulmonary blood vessels will undergo vasoconstriction under the effect of hypoxia. Okay guys, hope the video is helpful. See you in the next video. Thank you.